researcher. Dr. Mosley, the floor is yours.
Thank you very much, Prof. Amar, for the very kind introduction. I'd like to thank also the organizer of this talk, both Faculty of Medicines at Khalifa University and King Abdulaziz University for choosing me to speak today about this very interesting topic. It's a real pleasure to be able to talk about something that I'm very passionate about. So to start, these are some of my experiences outside of publications and training. Some of the experiences that have facilitated my ability to produce more research and were also a result of being interested in research. So head of the IBD unit at King Abdulaziz University Hospital. I'm also head of the Student Research Evaluation Unit at King Abdulaziz University, President-elect for the Pan-Arab Crohn's and Colitis Association, Chair of Research Committee at the PACA, member of the Saudi Clinical Trials Committee, member of the IBD Task Force and Guideline Committee, and as mentioned, I'm Associate Editor at 2 journals. So as you can see, these are things that consolidate my interest in research and help me focus on working with several collaborators in the field. Now, a question at the beginning of this talk is, why do clinical research at all? So typically it's motivated by an interest in academia in general, or an interest in academic aspirations. So people who work at academic institutes hope to get promoted as required by their institutions, and this is usually contingent on their ability to produce clinical research. Another reason is for specialized clinicians who manage complicated patients or patients with certain diseases that require specialized attention, are interested in enrolling patients in clinical trials, hence their interest in pursuing being site investigators and investigators that lead clinical trials. And sometimes there's no reason at all other than wanting to be a researcher. But to keep in mind, clinical research in general is not financially driven because it's not really financially rewarding. Some of the obstacles that are commonly mentioned or that are reported as being mentioned by people who want to do research is that first of all, I want to do research, but I don't know how. I want to do research, I know how, but I don't really know where to start. I don't know how to do statistical analysis specifically, and I find that a big problem. I finished a project, but I don't know how to write up a manuscript. I did write up a manuscript that I finished, but I can't seem to get it published, so I must be doing something wrong. Or I'm stuck doing low quality research. I need to evolve and produce higher quality of research, but I don't really know how. So I'll try to address some of these obstacles as much as I can in this talk. So steps you should take when you are about to start a career in clinical research. So first of all, develop a genuine interest in research. So keyword here is genuine. Lots of people say I'm interested in research, but they don't really take further steps in nurturing that interest or making it turn into reality. Following that, one of the most important steps in the journey to becoming a good clinical researcher is finding a good mentor, and that is something that I think most people with a good track record in clinical research say, and usually to find a good mentor, you need to always look at qualities that a good mentor should have, and I'll tell you a little bit about that in a minute. So following that, you need to expand your research knowledge, so know more about research and how it's done. And most importantly, you need to learn how to practice evidence-based medicine, which is a mentality really, and somebody who wants to do research has to know what research means in terms of its impact on clinical practice and on medicine in general. So you'd have to link your mindset of thinking in an evidence-based way with your plan to produce research. A very important step is to learn how to ask a research question. That's usually how any research project should start, is through a very simple and very clear research question. Learn how to answer your research question by objectively examining the literature. So what's out there, what's been done in terms of studies to answer such a clinical question. And subsequently learn how to perform research on your own and then publish your work. And we'll talk about these steps in detail. So developing an interest in clinical research. So you need to understand that clinical research can be slow, at some points even painful and discouraging, but eventually once you get a handle on it, it's very satisfying. Second point to consider is that you really get better at research with time and practice. So expect that the first time you try to do clinical research, it might seem difficult, but the more you practice and the more you move from one project to another and complete them, you'll find that it's easier with time to fulfill all the requirements to be a good clinical researcher and be productive. Involve people, students, trainees, and colleagues in your projects and collaborate as much as you can with them. Sometimes you need to think small wins versus big wins. Always think that way, because it's very difficult to always do big projects and focus on studies that have big impact. You sometimes have to accept smaller wins with smaller studies, and we'll talk about some of the study designs that are in these categories. And as I mentioned, collaborate, because that's the key behind being a successful researcher. And finally, research is not for everyone, and that's okay. And sometimes you come to know that with time or even from the beginning. So I wanted to share you with this paper. So this is my first research paper that I published back in 2011, I believe. So the story behind this is that I was a trainee. I didn't really know how to do research, and I was tasked with a research project as the requirement. So the idea was, there's this stool test that physicians used to order at the center I was training at for ova and parasites in the stool. And parasitic infections are very rare in Canada, unlike other places in the world. And despite that, physicians used to order this test for almost everybody. On the span of a few years, and then figure out how to save cost. So it took me around a year to finish. I basically did everything myself. After finishing the paper, I actually presented it as an oral presentation at a regional meeting, which was very exciting. But then when I wrote the paper and tried to submit it and get it published, it got rejected 12 times. So my supervisor said to me after the 5th rejection, this probably won't get published. Let's just move on to something else and just give up on this paper being published. But I kept trying, and I got it published after 12 attempts. So after publication, the institute that I worked at got a hold of it and developed a special pathway for physicians to order the ova and parasite testing in the hospital using a restricted criteria. And they ended up saving about 10K per year based on this step, which was huge, for budgeting. So my supervisor later on called me to the office, and he just wants to say, listen, I want to tell you that I owe you an apology, and through this project you have taught me how to be persistent. And those words meant a lot to me in terms of motivation, reflecting how a mentor, even through very simple steps, can motivate somebody to keep going and aim to keep producing more and more research. Now, to find a mentor, I think is one of the most important steps in your career as a clinical researcher. A good mentor will guide you and help you develop a taste for conducting research. This mentor, he or she has to be patient, experienced, well-published, very active, has a positive attitude towards your work and ideas, efficient, and most importantly, easy to reach and to communicate. And what happens is, your mentor typically and subconsciously transmits all these virtues to you, and you pick up these same characteristics, and hopefully with time, you become a mentor with the same attitude. So this is my mentor, Professor Brian Fagan from Canada. He basically is the reason why I chose to specialize in IBD and to pursue a career in clinical research. I started working with him when I was a resident, and we continued to work together for 4 or 5 years. And we had many, many publications. I actually lost track after a while how many publications we have. And we continue to collaborate till this day. So second step is to expand your research knowledge. Now, there's some simple ways to do that by, for example, reading articles, engaging in journal peer reviewing, and visiting evidence-based medicine websites. A very important step is to learn how to critically appraise scientific papers. So you should develop the ability to look at a publication and judge whether or not this paper is of low or high quality through steps that are well known for critically appraising such papers. The introduction, the methodology, so on and so forth. Because once you start to critically appraise these papers and begin to familiarize yourself with things that deem papers low quality, you start to acknowledge these things as deficiencies that you don't want to have in your own projects, and you start to apply higher quality standards in your work. You can pursue engaging in research projects, research workshops, seminars, comprehensive courses, or even diplomas. You can take that a further step and do a master's degree in clinical research or epidemiology, or even a PhD degrees. So this is, of course, the extreme, and it's probably for people who focus mainly on research as a career. So what is evidence-based medicine? So evidence-based medicine is the integration of best research evidence with clinical expertise and patient values. So this definition of what EBM is and isn't has gained wide acceptance and made it easier for us to get our points across. And as you can see, this has been linked with better outcomes in terms of clinical practice in general. And the reason why evidence-based medicine is important is because of the ever-evolving and rapid accumulation of literature over time. And as you can see, there is somewhat around 5,000 papers produced every day with the new information and new data that could support certain clinical practices and treatments, of course. So the steps you should take in order to practice evidence-based medicine is, number one, ask a clinical question, be able to acquire the best evidence out there, appraise the evidence as we mentioned, and then try to apply it. And finally, assess the impact and performance of this application on your own practice through auditing. It's very important to understand the hierarchy of evidence in the literature. And as you can see, with time, we've moved from what was before known as traditional sources of information, such as textbooks and expert opinions, to things that are more objective. And it used to be that randomized controlled trials are the highest level of evidence, but recently meta-analysis, systemic reviews have become the tip of the pyramid because they can link multiple RCTs together in one data set and give you a pooled estimate that is probably of more value, provided that, of course, it's of good quality. So if we go through these steps in detail, we can say that number one, formulate an answerable question. That's very important, and we'll talk about that. Track down the best evidence through your ability to search the literature. And there's, of course, known search engines that you can use to look at evidence out there. And the probably most commonly known one is PubMed. Critically appraise the evidence for validity, clinical relevance, and applicability in patient concerns. Evaluate your own work and performance, and finally, make EBM your way of practicing medicine, and don't accept non-evidence-based medicine practice in general. So how do we ask a research question? So first of all, you typically can make an observation that is clinically relevant when you're practicing, and you can usually try to focus on hot topics that are of interest to the general audience of medicine. Go and read about it through conducting a literature review, like I said, mainly through PubMed. Challenge the evidence if you can. Debate the answers you find by yourself or through discussions with colleagues so that you can gather other opinions. And then develop a specific, clear, answerable question, taking into consideration the medical condition. This could be descriptive, comparative, or causal, but usually I recommend that you start with easy questions. And the general rule always is the PCOT format. If you don't have a clear question, then you can't and you shouldn't move forward in your project. So this is a clear question. So the PCOT is participants. So, and in here you decide on the participants through adhering to study inclusion exclusion criteria. Then you choose the I, or intervention. This could be replaced with an E depending on the study design, as exposure. And here you need to focus on definitions of these two things, and these definitions need to be very clear. C is comparator, so absence of an intervention or exposure. And then you have the O, which is outcome. And here again, definitions are important. And finally, time. And time can be very dependent on the type of study you choose to conduct your project. So build your plan based on this format. This is where everything starts with regards to a research project. Now, the research question and how it's displayed determines what kind of project, or sorry, what kind of study design you should probably perform. So if you're asking about how common a problem is, then you're asking a prevalence type of question. If you're asking about, is early detection worthwhile? Here we're talking about screening impact and mainly a cohort study. Diagnostic test accuracy, so how accurate is this test? Then you're talking about a DTA type of study, which is diagnostic test accuracy, and it's typically a cross-sectional design. If the question is more like, what will happen if you do nothing? Then we're talking about prognosis, and this is typically answered through a cohort study. Does the intervention help? What are the common harms of an intervention? And what are the rare harms of an intervention? And here we're talking about a clinical trial or experiment related to treatment. Next is knowing how to answer your research question. So this is how you should proceed. Start with a protocol. And a protocol should include a study title, investigator and affiliation in the first page. And then you should have a short background, which is a summary of your literature review, basic knowledge of the topic, what's known about it, display the part that is debatable, and why it's important to do more work on this topic. Then your aims, if you can, find a good librarian to help you if needed. The next section is basic methodology, so design, setting, timeline, inclusion, exclusion criteria for the study, data to be collected, exposure, outcomes, and definitions. And again, I stress on this point, be very detailed with the definitions because they really matter. And they can be a source of bias if they're not very clear. Basic statistics come next, in addition to a sample size calculation. And for this, I would recommend consulting a statistician. Finally, ethical considerations, and then references. So a protocol is very important to have. And I don't think any study should start without having a very complete protocol. You should discuss this with your mentor to get their feedback, revise it, expand. The more likely you'll end up with a successful publishable study. Average time to complete the protocol is about 6 to 8 weeks. And as I said, it's very important to consult a statistician, but I would recommend doing this at the protocol stage rather than after the study is completed, because it makes it more difficult for the statistician to be able to do their analysis. This is what a typical protocol would look like. And here's one of the studies our students worked on. And as you can see, first page, you have the title, investigators, and then some of the roles of these investigators. And then this is the background, and then the methods. And then we have outcomes, selection of controls, because this was a case control study, and then a brief description of statistical analysis and sample size calculation, ethical consideration, and then finally references. So it's mainly 6 pages and very brief. So next is how to decide which study design you choose to conduct. And as I said, it really depends on your research question. So if you're asking about an intervention, so what should I do about this condition or problem, then you're looking to answer this through a randomized controlled trial. And sometimes this is not feasible, and you have to accept a cohort study design as an alternative. What causes this problem, which is mainly etiology and risk factor, and here RCTs is sometimes, or let's say most of the time, unfeasible, and we'd have to rely on either cohort or case control studies. Does this patient or person have the condition or problem? Diagnosis is usually cross-sectional design through random or consecutive sampling. What will happen with this problem? Here we're talking about prognosis, and again, here we're looking at a cohort study, less so a case control, and the lowest type of quality for this type of question is probably a case series. How common is the problem, which is a frequency and rate, i.e. prevalence, and this is answered through cross-sectional design. Unless you're looking to measure or estimate incidence, then you have to do a cohort study. Here's a summary of how these questions look like and how they're answered in terms of study design. And with time, we'll come to automatically be able to link the study type with the type of question, depending on how much practice you do. Bias is a very important concept to understand for anybody who's doing clinical research, because bias can alter your results significantly and can be a reason for absence of validity of any paper. And this is really related to the study design, because things like randomized controlled trials have a very low potential for bias, whereas clinical observation type of study, which is case reports and case series, have a very high potential for bias. And here there's the category of observational type of studies compared to experimental, which each have very different susceptibility to bias, and bias actually can occur at different levels in different types depending on that factor. So what is bias? It's a systematic error in the design or conduct or interpretation of a study. In order to prevent and control for bias, you need to look at either, number one, ensuring that the study design is appropriate for addressing the study hypothesis. So the design. Number two, establish and carefully monitor procedures for data collection that are valid and reliable. So here you're focusing on measurement. Number three, use appropriate data analysis procedure, so your analysis. And finally, quantifying the potential magnitude of bias by conducting a bias analysis when your study is complete. Now, when we look at study designs, this is a very simple way of categorizing it. So starting with the exposure. So if exposure is assigned, then mainly we're looking at experimental type of study, depending on whether or not the allocation of patients is random. So if it is random, then we're looking at randomized controlled trial. If not, then it's mainly unable to assign exposure, then we're mainly looking at an observational type of design. And depending on the presence or absence of a comparator, studies are categorized into either a descriptive type of study or an analytical type of study. So if it's analytical, then we really look at the direction, linking exposure to outcome. So if exposure comes before outcome, then we're looking at a cohort study. If outcome is looked at the beginning, then we look back or forward for exposure. then we're talking about a case control design. Now, descriptive studies are very simple. Some might say they're not even real type of research, but they could have a very significant clinical impact depending on the clinical context and scenario. So the advantages of these type of studies is that they can help identify new diseases and trends, or even side effects. They can have significant influences on subsequent literature and possibly on clinical practice in the right context. Disadvantages is they're generally short-term. There's a high potential for selection bias, and there's usually no controls. And you can use something called the care checklist to be able to report such studies. Now, if you're familiar with this phocomelia, you'll know that this was a result of exposure of mothers to a certain drug back in the 70s, which was picked up through case reports and case series. As a result, thalidomide, a drug that was used back then, was stopped, and this became a very well-known side effect of exposure to this in pregnancy. Now, surveys are very common. They're quick and easy to conduct, ideal for students and those who are just starting to do clinical research. Doesn't require sophisticated statistical analysis. Doesn't require follow-up. There's very minimal R&D requirements for it. And now it can be done through online questionnaires. I did a lot of these over the past years, and most of these were done by or in collaboration with medical students and trainees, and generally they're very easy to do and easily publishable. So moving on to the analytical type of studies, and like I said, it depends on the sequence of events between exposure and outcome, or how you search for these. So advantages of these types of studies: they're good for studying rare conditions or diseases, useful as initial study to establish associations, and ideal when working with med students or when you are just embarking on a research career. Disadvantages: they're retrospective studies, and so they have more problems with data quality in terms of recall bias, but sometimes that's all you have. They're limited to examining one outcome, and not very good for rare exposures. And of course, one of the main pitfalls of this type of studies is confounding bias. Now, when are case controls and cohort studies warranted? So essential importance for questions related to harm and where trials are not feasible. So one of the pros is feasibility and avoidance of certain ethical issues. Some of the cons, that they're very prone to biases and especially to confounding bias. And this is something that should be acknowledged at the beginning, so you can try to minimize these biases as much as you can during the conduction and analyses of these type of studies. Again, I've done a lot of these over the years, and as you can see, most of these, this is samples. Some of these are with med students, some of these with trainees, but generally speaking, collaborating with med students, trainees, and even GI fellows in my case was very easy. Next, we'll talk about systematic reviews. So systematic reviews mean basically to systematically be able to identify, appraise, and synthesize evidence from studies addressing the same research question. These are some of the systematic reviews that I completed over the years. The issue with these, that they are somewhat time consuming. They take a long time to complete. They require knowledge of how to conduct them. And the statistical analysis are somewhat complex, require help with a statistician. And to start with, to be able to do your literature review in a systematic way, you need to either learn how to do it professionally, or seek professional help through a skilled librarian. These are some of the figures and data that you can produce through these types of studies. And if you look at the left, here's an example of how exhaustive these types of studies can be. And you can see on the left upper corner that here we started with that we had to search through to be able to finally identify 19 studies that fulfilled the selection criteria. But generally speaking, the results can be very satisfying and can have a very good impact on clinical practice. So finally, randomized versus non-randomized studies. So randomized trials, here, random and hopefully concealed procedure decides which participants go in which arm. And this is a procedure that reduces the risk of selection bias, mainly confounding as well. And placebo controls and double blinding is possible to reduce the risk of ascertainment bias. On the other hand, non-randomized studies and cohort studies, here participants are self-selected or are selected to receive an intervention or exposure. And in this case, you cannot rule out selection bias. Placebo controls and double blinding is not possible in this type of studies, and that increases the risk of ascertainment bias. So to become a clinical trialist, you have to probably be working at a tertiary care academic center. You need the proper training and experience. And I believe that this is more for specialized clinicians who have, patients at a specialized level. You need to be really interested in this field. Patient, you should have stamina and support, secure funding, grant, sponsorship, and also have infrastructure at your center with a coordinator, a clinical research organization support, data registry, patients, of course, a pharmacist, statistician, and as you can see, all of these need time and patience to acquire. Long-term gains include experience, outlet for advanced treatments, high-quality publications, expanding your ability to have grants and funding. It's a source of nominations and rewards, and for building a reputation as well. Now, one of the obstacles I mentioned at the beginning is inability to publish your work. So some of the advice I can give you: don't rush your work, but don't take too long either. The more time you spend on your protocol, the more likely you'll publish your work. Do not get discouraged. Average rejection before acceptance is about 5 times per paper. Make sure that when you write your paper, that the writing is perfect. Use simple language without any typographical errors. These are considered sins by editors and peer reviewers. Sloppiness often decreases the chance of acceptance, so I'd recommend consulting with a language editing service before submission. Multiple rounds of revisions back and forth between you and your mentor or with your colleagues or collaborators is very normal. You will learn how to choose the right target journal with time. If you're unsure, then aim high and work your way down the food chain. And always remember, every paper has a home, no matter how long it takes. I would also stress that arguing with reviewers is not good habit. It doesn't really lead to any benefit. Don't send any angry emails if your paper is rejected, and don't take it personally, because it usually isn't. These are some of the major sins of research, and I hope that nobody who practices research commit them. So do not plagiarize, do not manipulate the data, do not fit the data to the question, do not throw away data because you didn't like the answer you got, and finally, don't finish do not finish, well, that's not written properly, but what I meant is don't not finish your work and not publish it. So general advice: start simple, advance with time, learn the EBM and research language, the meaning of bias, the meaning of estimates, study designs, and so on and so forth. Try to reserve time in your schedule for research, collaborate as much as you can, work with people who are passionate and aim to achieve. Look for different venues for collaboration in basic science and other places outside of your realm of colleagues. Try not to abandon any project you've started. Aim high when it comes to the quality of your work, and finally invest in registries and databases, because that's a good source of data. For anybody interested in research, I recommend joining ResearchGate. It's a very good website, or let's say more of a social media outlet where you can track your own citations and publications, and also link with other collaborators and see how they're doing and what kind of papers are being published. You can also be able to download some of the papers your colleagues published at no cost. So that's my final slide. I'd like to thank you all for your attention, and I'm open to answer any of your questions. Thank you very much.
Thank you, Dr. Mahmoud, for the quite informative and motivating lecture. We'll open the floor for questions. Audience, from the audience, if they have any questions or comment, you just raise your hand. We'll give you we'll enable your to talk and comment. Let me start with the first question. For a new researcher, for a younger researcher, Dr. Mahmoud, what do you advise regarding to the basic skills he should be equipped with?
So
at the personal level.
Yes. So of course, some of the things I mentioned at the beginning, which is having a genuine interest in research, because if that interest is genuine, that will motivate you to learn and to search for answers. There's a lot of tools out there for you to utilize, and there's websites with tutorials. There's some very nice textbooks about simple ways of conducting clinical research. But more importantly, you need to be patient. You need to have the support of a good mentor, and then with time, all the other things will come together. So the ability to generate a research question, as I mentioned, to write a protocol, to collect data, to select the right study design, and then finally to write up a manuscript and summarize the results are usually subsequent steps that come with time. And of course, the first paper you write will be difficult to write, but then once you start writing and once you complete it and you'll feel good about it, then you're going to move on to the next one, and that's going to be easier and better, hopefully.
Can you elaborate on the role of medical colleges in motivating the students and equipping them with the necessary skills for research?
That's actually a very good question. I think much of the responsibility of how much research-oriented medical students are falls on the institute. For example, at our institute, King Abdulaziz University, there's a very strong drive and training medical students to become clinical researchers, and we've incorporated research starting from the first year of medical school. And in the first 3 years, they learn something called foundation of clinical research, which is very basic. And then once they get to the 4th year, there is a program where having a research project, graduation project, is mandatory. So from the 4th year, they have to submit a protocol with a mentor or supervisor assigned, and then that goes through an evaluation process. Once it's approved and it gets ethics, then the student or student group has 3 years to complete that project, and they have to have it submitted by the end of the 6th year for evaluation. So that ensures that throughout medical school, the students have had enough exposure in both theoretical and in a practical way to clinical research. And I think such a program or such a model is very successful, and it's been replicated by many other medical schools as well.
What will be your advice at the institutional level for the decision makers in order to promote research and research productivity?
Yes, I do. I think the more interested the institute is in clinical research, the more likely students will inherit that interest and develop an interest in clinical research and in evidence-based medicine in general.
Dr. Ali, do you have any question to address?
Well, yes, thanks a lot, Dr. Mahmoud, for a very enjoyable talk.
Thank you.
I have a question that, I'm asking because I think some of our younger clinicians or researchers might be interested in that. What pointers would you give to our students, maybe, and young researchers about, talking to your patients? Because remember, sometimes we do clinical research that would require you finding the patients and preparing, of course, the consent forms and all that. So, somebody with your experience, and remember also we have different traditions and societies. You know, in some places they don't like to participate in research at all. So can you give us some pointers about talking to patients as well as preparing a good, effective consent form?
Well, yes, no, thank you. That is a very important point, and I think communication skills is something, you know, highly linked to your ability to conduct research, because as you said, in order to be able to collect data, you need to go through certain steps that requires communication with patients or, you know, participants in general. So your ability to be, you know, to conduct a very clear, honest, straightforward conversation with a patient is vital, and you need to be always, you know, honest and clear and objective in these conversations. I always recommend that you practice, or the dialogue that you plan to have with patients is rehearsed with your mentor at least once, in order to you know, develop a very good skill. Usually have your documents with you. You know, the study protocol in any study should be carried with an investigator at all time. Have the consent form written up and made in a very clear way with all the information. And you should always remember, participating in a study is something that a patient or a participant has, you know, free will to choose, and they can easily say that they do not want to participate, and that's okay. So that wouldn't be a reason for you to, for example, you know, mislead a patient or you know, hide certain information from them. Of course, here we're talking about, you know, type of clinical studies, you know, where there's virtually no potential risk factor, or sorry, risk for, you know, adverse events or side effects of harm in general. But still, you know, taking up a patient's time to fill a questionnaire, for example, or a survey, is still something that should be appreciated, and you should be able to communicate that to the patient in advance.
Thank you, Dr. Muhammad.
Thank you. Dr. Mahmoud, how do you see the role of industry in promoting research?
So industry's involvement in clinical research has several facets. So we can start with the most advanced one, which is, you know, sponsoring and funding and supporting clinical trials. And here I'm not talking about pharma-sponsored trials, because that's something that is, you know, in favor of you know, interests for you know, sponsors and for pharma in general. But what I mean is sponsoring investigators to launch investigator-initiated studies, things that have nothing to do with the, you know, promotion or development of drugs. And then you have pharma's support for clinical research to create, you know, databases and registries, and there's a lot of grants that you can apply for to get funding for such you know, registries and databases. Now, when it comes to academic type of research, pharma is not usually involved in supporting those type of research projects, unless there's, for example, a certain fund, or if there's like a scholarship that is in the name of pharma for medical students or for, you know, trainees in general. But I think the bulk of their support will be for investigators, for investigator-initiated studies, which can be very difficult to conduct, and therefore do need the help and sponsorship of pharma.
Thank you. Any question from the audience? How do you see the future of research with the government vision 2030 including research, development, and innovation?
I think the future is bright. The unbelievably large number of opportunities out there to engage in research through, you know, governmental funding and scholarships and grants is a reason for researchers to be more motivated and to aim to produce high quality research. And I think that over the next few years, we'll see more and more researchers and more investigators out there trying to do so.
Thank you. If there are any other question from our audience, otherwise we will come to the end of this seminar. I should thank Dr. Mahmoud for the nice informative lecture, our colleagues from Khalifa University, and our audience for the kind attendance and collaboration. Thank you so much. Hoping to see you in the next lecture within the series of seminars in the twinning project between King Abdulaziz University and Khalifa University. Thank you very much.
Thank you very much.
Thank